overcome. These simple words have been spoken by generations of Americans who have inspired us to look deep inside ourselves and commit to living out our highest ideals and values. And now Americans are uniting once again to etch these words into history.
We are coming together across political parties. We are bridging our differences of faith, race, ethnicity, and social class to tell Congress that Americans want affordable, quality health care for all people.
As people of faith, we seek to hold up a prophetic vision for our country.
We hold up a vision where no parent has to fear that losing their job also means losing health care for their family.
We hold up a vision where no person has to rely on emergency rooms for their health care or delay treatment because they lack insurance or have been denied coverage.
As faith leaders, we believe that fixing health care is not only essential to stabilizing families and communities, but also a moral imperative.
A nation that values life created in God's image cannot stand by as 20,000 people die each year for lack of health coverage.
A nation that values family cannot watch as millions are forced into bankruptcy by health bills that they cannot afford.
Every day we see people in our congregations who are losing their jobs and health coverage. Our food programs, health ministries, and safety net clinics are overwhelmed. More and more people who were once secure in their health care have lost their ability to keep their families healthy and stable.
My statistics fail to tell the heartbreaking human story of suffering that I witness at Good Shepherd, my church, every day. A report can't reveal the anguish of a mother unable to afford a doctor's visit for a sick child, or the pain of a husband ignoring a debilitating injury because the deductibles and copays are too high to afford.
Ministering to ailing families, I'm reminded more than ever that our healthcare debate is about fundamental values. Nothing less is at stake here than whether or not we're going to live up to our highest ideals as a country.
People of faith expect both political parties to actively pursue comprehensive health care reform.
We want those who like the health care coverage they currently have to be able to keep it.
We want those who have coverage that they cannot afford to have new, more affordable options.
And we want those who have no health care coverage at all to be brought into the table of plenty that we call our health care system.
Through prayer, teaching, and action, we are building a national faith-based healthcare reform movement. In our congregations and communities, we are committed to helping families understand what they have at stake in the healthcare reform debate and how they can make their voices heard with their members of Congress.
Over the coming months, PICO plans to hold rallies with our members of Congress and generate thousands of calls to Congress in support of comprehensive health reform.
Join us in remaking healthcare this year so that it reflects the best value of our nation. Visit www.coverallfamilies.org to learn how you can make a difference today.